At Whittier Street Health Center, we are maximizing value for patients, achieving the best outcomes at the lowest cost by viewing every patient through the prism of total care. Whittier sees beyond medical conditions and disease states. We see the myriad of social factors that influence our patients' everyday lives. We see people who need economic stability, safe neighborhoods, education, jobs, quality nutrition, exercise, and specialized services that address the social context of daily lives. We see barriers and inequities in care that must come down to provide greater access to quality care. Welcome to Whittier Street Health Center.
I think that is very important to identify someone's strength and you help them in that direction.
Whittier is surrounded by economic stress. Approximately 91% of our patients live in poverty, and 83% reside in one of the 17 public housing developments within a mile of our facility. 2/3 of our patients live in North Dorchester, where the unemployment rate is nearly 18%.
I was homeless for about 6 months. I was on the streets and I wanted to get into a healthcare system and I didn't have one, and that's how I came here. What Whittier does, it puts you in a system, in a healthcare system that has all these programs in it. And I was linked to a housing program that I eventually got housing. I told them, what I do. I love sewing. I love doing community work. I'm blessed in the same things that I love to do, helping people, sewing. They've given me, some platforms here, just show off my skill and what I can do.
Our primary mission is to meet the community's medical needs, but we are also resolved to do more. To break the cycle of poverty, we make special effort to hire from our own neighborhood. Today, more than 60% of our employees live in the communities we serve.
I felt like this joy inside of me, and I was like, really? I'm gonna have a job back, Now that they have given me the opportunity to be one of the employees, here, I am more than appreciate, what they have done for me. It is very important because the health ambassadors are patients. And when we are patients, we are more compassionate.
The need is high. Neighborhoods in our densely populated service area are plagued with crime and violence. Adding to the challenge is the high incidence of chronic diseases, with 2/3 of Whittier's patients diagnosed with diabetes, hypertension, cancer, asthma, or obesity. The toll is alarming. Residents in our area have a life expectancy of 59 years, a full 33 years fewer than their neighbors less than 2 miles away in Boston's Back Bay.
I come to Whittier for counseling. I have 3 children, and I lost a child who was close to me like a son through street violence. He was murdered, and after that, my son, it was more harder for him. The streets became harder. It just became really hard to be in the city. I went through the Women's Health and had someone who helped me with housing, searching and stuff like that. I see my son definitely being able to see his potential. He has started to work, got a job out there, so he's definitely, safe. I'm safe, I'm able to know that.
In our youth violence prevention program, which annually engages more than 800 youth, we collaborate with community partners to identify vulnerable youth ages 14 to 21 and connect them with behavioral health, substance abuse, life coaching, domestic violence, and educational support. We address prevention of destructive behaviors in our Whittier Youth Empowerment Program, which serves at-risk minority males ages 10 to 18.
Well, it helps like us youth figure out what is safe and what isn't safe around sex and STDs and alcohol abuse and drug abuse. I've taken the math tutoring and the fitness program. Since I'm in the youth program, it allows me to go there for free, and I can train my body so that when I'm doing heavy lifting or other things that require strength or fitness, it allows me to be well and keep my body healthy for later years.
Safety is paramount. At Whittier, our fitness center not only offers a safe place to exercise, but also a wide range of innovative programs to address health and well-being. Our bold approach to fitness recognizes that we live in a complex society and face a lot of social disruptions that can damage our health. Our bodies know how to fix themselves, they just need to be given the right tool, and that is what we offer our patients.
This place has been a godsend. I have been seeing nurse practitioner Lasley, and she's been helping coordinate with my rheumatologist and other specialists over at BMC. She helps keep track of my fitness and wellness activities downstairs because I spend a lot of time down there, whether that be with nutrition, working out, taking classes, the wellness program. I've been here for it all. It's been fantastic. Whittier Street is an exceptional gift to this community. I actually come here from Hyde Park, but for the people here in Roxbury and even outside of Roxbury, this place is like an all-in-one.
Statewide, substance abuse and the opioid epidemic are at crisis levels. In the neighborhoods we serve, the treatment of opioid abuse is unequal, focusing largely on punishing offenders with jail sentences instead of access to education and healing resources often provided in suburban communities. At Whittier, patients receive respectful, compassionate care with no stigma.
I had a substance abuse problem from an on-the-job injury, and I got addicted to opiates. It almost should have a Surgeon General's warning on it, like highly addictive substance will ruin your life, will make you homeless, will put you in jail, if not in the ground. Well, I ended up going to Suffolk County House of Corrections here in Boston, and on my departure date, I was referred to Whittier Street Health Center.
Each person is blanketed in an integrated range of services: primary care, referrals to specialists, behavioral health, acupuncture, physical fitness, physical therapy, massage therapy, prescriber education, and patient and community education.
I got linked in with behavioral health and started the Suboxone program, which is a replacement therapy program, and along with counseling. Well, if I hadn't come to Whittier Street Health, I would probably be in what they call the detox spiral, the spin dry. Going to detox on an acute basis, 5-6 day term, which doesn't address anything, and not like at Whittier here, where you're an actual person, you're somebody.
You thought about going back to school, Nicholas?
Studies show education level is the single most important predictor of future health. It positively impacts health determinants such as smoking, exercise, and drinking, reducing the risk of heart disease, diabetes, and obesity. It leads to better jobs. Many people in our service need help tapping into schools and training programs. Nearly a quarter of residents of the Roxbury North Dorchester service area lack a high school diploma or GED, more than double the rate citywide, and only about 12% have a college degree. Not only does this reduce job prospects, but it also affects the health literacy of our service area.
Whittier is important because it connects people. My first day, I loved it. People are amazing. I've seen like numerous amounts of families, different groups of people. There's a lot of diversity.
To help our neighbors shape a brighter future, Whittier is building bridges to education. In our computer lab, we offer classes led by our information technology staff.
We have so many different things going on that when I started looking on a list, they have a lot of things there. So coincidentally, I'm here and a patient. Then I kind of saw all the other avenues that they have here. So I became an outreach ambassador, and with the computer classes. And once you get inside, then you see it's definitely worthwhile. It's someplace that's very needed.
To create future community leaders, we offer the Whittier Youth Services and Enrichment Program to immerse young people ages 13 to 22 in goal setting, conflict resolution, time management, financial responsibility, and making healthful lifestyle decisions. Our participants use their earnings to save for their college education.
The skills they teach us, it definitely helps for an actual job. So when I go out there, sign out my resume, do all this other stuff, it's definitely beneficial. I feel like I might try and go to art college like Montserrat, maybe Mass Art. I might go out of state. I love the fact that it's a healthcare center that focuses not just on you physically, but you emotionally and your emotional stability.
An alarming reality is that approximately 50% of Whittier's patients are dealing with food insecurity. Children in our service area have limited access to nutritious foods. Pregnant and nursing mothers are struggling to nutritionally support their babies. People with chronic diseases often are unaware how nutritious foods can help manage health conditions. Families find it difficult to find quality, affordable meats, vegetables, and fruits in local grocery stores.
Eating healthy is not cheap, so the Fair Foods $2 bags have helped me and my family a lot. When you can get healthy food for a good price, that just makes it easier for low-income families such as my family and I.
Taking a hands-on approach to improving the nutritional profile of our community, Whittier offers a teaching kitchen, prescription for food, emergency pantry, trustees mobile farmers market, fair foods, women, infant, and children or WIC programs, and a community garden.
In this area, you have a lot of people who receive food stamps and, the poverty level is kind of bad. So with this program, a lot of people come and they get a $2 bag, as many bags as you want, for potatoes, onions, and whatever that's come out of the garden. It's a big help.
I enjoy seeing it grow and then actually going out and picking my own greens and bringing them home and preparing them from the ground and to my stove and to my stomach. I enjoy it a great deal.
Whittier practices anticipatory care, not just repair care. You don't wait for your car's engine to start smoking before you get it serviced. Our primary mission continues to be offering quality medical, dental, eye, and behavioral health services in 2 sites in Roxbury and North Dorchester.
I found that Whittier Street had people in the communities that had no idea what to do about their health. We try to empower people and tell them how important it is to be healthy. There's a healthier way to live.
And we also concentrate on the context of our patients' lives, empowering them to address the complex range of social factors that affect health and well-being.
I was at the halfway house after I got out of prison, and they sent all the guys from there over here. I have a prosthetic leg, and I have HIV, and I had all kinds of, I was having seizures, I had all kinds of health problems, This girl, Diana Birouette, who was my medical case manager, and Diana got me the ride. She put in the paperwork for it, so now I have the ride. So I don't have to take subways or anything like that, It was just tough, with one leg and, Diana's the one who helped me get that dog. She drove me on her own, in her own car to the shelter, to get the dog. She would help me do that, I mean, they went way above and beyond, just medical care, And so I was really cool with that,
Whittier is the bedrock of health in our community, providing a wide base of services regardless of ability to pay. Of the nearly 30,000 patients we now serve, from the many cultures of origin represented, approximately 36% of adults and 40% of children are uninsured.
Somebody dropped us at Whittier and said, okay, you go in, they'll help you. We came in, we introduced ourselves, and it was amazing. One thing that struck me when I walked in was there's a sign there. It said that we treat everyone irrespective of whether you have insurance or not.
To reduce disparities in cancer care, in 2012, the world-renowned Dana-Farber Cancer Institute opened a clinic at Whittier. The clinic is designed to create new pathways for underserved populations who may not find their way to a tertiary care center.
I'm attending Dana-Farber. They are looking after my after-cancer care. Whittier afforded me care at a top-notch facility that I would not, I think, ordinarily have been open to getting. Nothing can threaten me again, if I would say that.
To increase access for all patients, our urgent care clinic in Roxbury is open 6 days a week, including evenings. Recognizing that people who live in North Dorchester face high rates of chronic diseases, we opened a satellite clinic on Blue Hill Avenue. Our team of infectious diseases and specialized populations provides far-reaching services for people with HIV, hepatitis C, and sexually transmitted diseases. Our partnership with the Family Van provides outreach in the neighborhoods to screen patients for HIV, offering a rapid blood test that produces results in 20 minutes. HIV-positive patients are connected to our clinics in Roxbury or North Dorchester. Whittier has a long history of implementing innovative programs and addressing the clinical and non-clinical needs of the patients served. We believe that by addressing the social and environmental factors that impact the lives of our patients and communities served, we will attain health equity and contribute towards improving the health and well-being of our patients and communities.